So for mid stages of HD, as you're getting into those middle stages, this is a good time to, again, we've already ideally been thinking about end of life, what we want for ourselves. And again, it doesn't have to be in any absolute terms, but just thinking and prompting those questions for yourself. So middle stages is a good time to start touring assisted living facilities and nursing facilities if that's something that you think you might want for yourself or your loved one. Continue those discussions around end of life and planning. Start at this point engaging support and help at home, whether that's family, paying for private services, home health care. Create a medication calendar or list. This is also why it's important to get into that electronic medical record and develop a patient portal so that you can keep track of your medications, any changes that are being made. So as you go to different physicians, you're able to accurately convey to them what it is that you're taking. Scheduling appointments with your care team, this is a big one. Primary care, any specialists, especially as we start getting into needing to make a case for disability. It's so important to have a medical record established with any of your specialty physicians, especially those that you may want to speak to some degree to your disability if you need to do any kind of appeals process or if you are requesting workplace accommodations. Again, that's early and middle stages. It's so important to establish that medical record, get in at least annually to see your providers, just to, again, be touching base and building that medical record. Yes?
A lot of acronyms on that last.
So sorry. Yes. Hospice, assisted living facility, or long-term care facility. Yes. And then the home health care is the HHC, and PCA is a personal care aid. So HHC, the home health care, is typically what if you're ordering through insurance, like a skilled nurse, PT, OT coming to the house. A personal care aid, or PCA, is typically a out-of-pocket private pay expense that is typically for what they consider custodial needs. So dressing, bathing, anything that you think a family member could do that doesn't require a skilled nurse, for example. And so those are typically out-of-pocket private pay expense. Yes?
Are there programs that assist with that when that becomes necessary?
Assist with which part?
Either or, just HHC.
The home health care, it just depends on your insurance benefit. My disclaimer to everyone is that Medicare, typically, Medicare has a benefit, but it's not a robust one. So it's not something that you can rely on. The home health care, it largely depends on your insurance benefit. It's also only ordered when there's a skilled need and for a temporary amount of time. So you see it mostly if you've been in the hospital, you're discharged, you need some support for a couple weeks, maybe for wound care, some PT, something like that. It would last for about that, maybe 4 or 6 weeks or so. So you might, during that time, have PT, have a nurse, have a home health aide, but once that 6 weeks is up, once there's no longer a clinical indication based on that initial diagnosis, then the services will stop.
So I guess just to elaborate on my question, are there financial resources that can help to offset that cost?
If you have a long-term care insurance policy, typically or usually those funds can be used to pay for a personal care aid. You can tap into those. If you don't have long-term care insurance, there really is not much out there to help families support that cost. Depending on where you live, depending on what state and what county you're in, there are services or sometimes grant funding that can assist and offset the cost. If you have state-based Medicaid, if you qualify for the state-based Medicaid, in that case, there is a personal care aid benefit through Medicaid, but you have to qualify for Medicaid, which is income-based and can be very difficult to qualify for, especially when we have families that typically it's been a few years that they've been working on one income, trying to navigate what's next. So sometimes on that one income, they still may not qualify.